welcome to AAPC Social Hour for Wednesday, May 11th, 2022. I hear birds chirping in Rhonda Buckholtz's neck of the woods. It's amazing. And it's so good to be with everybody today. We have Jaci Kipreos and Christopher Chandler here with us, along with Rhonda Buckholtz. Hello, you guys. How are you?
Good.
Doing great. Good to see
you.
Awesome. Well, it's so good to have you guys with us today. Rhonda, since you definitely have the most interesting background right now.
By far.
Yes. So tell us, where are you?
Yeah, so I'm actually blessed to be home right now, and the Pennsylvania weather is beautiful. I might have to change my view here in a second, though, because I hear my fan on my laptop starting to overheat. So I might not make it out here that long.
Well, I know you've been on the road quite a bit, visiting chapters, speaking at conferences. Where is your next stop?
My next stop is actually Friday for Philadelphia to speak for the Philadelphia. They're doing a one-day seminar. And so I'm excited to be able to go, and they're like home to me. It's on the other side of my state, but I'm excited to be able to be a part of their conference and just start seeing things happen in person again.
Hey, is that Rita's chapter?
It is. Yeah.
Awesome. That's great. Well, Christopher Chandler, I think this is the first time that we've met.
Yes.
So tell us a little bit about yourself.
Yes, my name's Christopher Chandler. I live in Salt Lake City, Utah, which is the home of the AAPC, which is quite wonderful and convenient. I work for Intermountain Healthcare. I've lived here for quite a few years now. Originally grew up in Maryland. I was just telling Rhonda and Jaci that I do miss the East Coast, but Utah has just become home now. So I love it here. The mountains are pretty spectacular.
Okay. And are you an outdoor enthusiast now?
Yes, but I don't like camping anymore. I used to camp a lot when I was a kid, but glamping I could get into. Camping I'm not very big into anymore, but I do love hiking. That's a lot of fun.
Awesome. Yeah. Roughing it for me and my wife is staying at a Super 8.
There you go.
You.
Everyone's got to rough it.
All over it.
So.
That's right.
I love the camp.
Well,
Never
Rhonda,
had a good experience.
Yeah. Well, Jaci, great to see you again.
Good to see you.
What's going on in your world?
Staying busy with audits and education. I just did a couple of virtual local chapter talks recently. Just brings my heart joy to speak to a local chapter. I haven't been to one live recently, and that's okay. I'm looking forward to going to Denver and seeing everyone. I'm actually leaving for the East Coast today. A little bit of fun. We'll be working, but we'll be starting out in Virginia to see family, and then we're going to North Myrtle Beach for a week at the beach with my husband's family. But we'll be working, but it'll just be nice to see a different view for a little while. And again, cannot wait to see everyone live in Denver. I just can't wait to see everybody and give them a big hug. I'm healthy, so I'm going to give them all a big hug. I've got 2 boosters, 2 vaccines, and I'm ready to hug.
Okay. Yeah. We had a great virtual health con.
Oh, we did. They did a fantastic job. They really.
But there's just something about seeing everybody in person that I think we all missed.
Yeah. Can't wait.
So looking forward to that. And we will talk a little bit more about that in just a minute. For those watching, everybody's rolling in a little bit here. And we've got Kimberly Williams, our friend from Texas.
Excellent.
Where it's warming up here in Utah. I know Christopher and I have dealt with the wild swing of Utah Springs. Snow one day. In fact, we had snow just the other day out where I'm at, up in the north part. But yeah, so starting to warm up. So we've got Lady Garcia from California. Good to see you, lady. And she says she can't wait to see us at HealthCon 2023 in Nashville. And I believe, did you win a free registration? I think she won a free registration.
Yeah.
So that's pretty awesome. Yeah, congratulations. We have Melanie Sen. I hope I said that right, from Elba, Alabama. Thanks for being with us. Kim Thrasher from Southern California, where it's always beautiful and sunshiny.
Mhm.
Yeah. She says she's taking a break from studying for the CPC exam. Kim, when have you scheduled your exam date? Let us know when your exam date is, and maybe we can give her a little tip or two. Yeah. So, well, we'll come back to that. But Kim, let us know when your exam is. Renee Tippin from Missouri. She says a newbie in Missouri. So we'd love to hear more about that. Renee, are you a student or thinking about this medical coding as a career path? Let us know about where you're at. We'd love to hear about that. But right now, we're going to let in our publishing team and see what's happening in Healthcare Business Monthly. And we've got Dr. Chaplin in the waiting room. Here she comes. Dr. Stacy Chaplin.
Hello, how you doing?
Great, how are you?
Oh, we're doing well, thanks, Alex.
Good. So we've got you with we're here with Christopher, Jackie, and Rhonda.
Wonderful, good to see everybody today.
Yeah, we're excited to hear about what's happening in Healthcare Business Monthly.
Excellent, let me grab my sheet here. So the June issue of HBM is going to be arriving in your inboxes in a few weeks if you get the e-version, and at the first of the month if you get a printed copy. Coming up in June, we introduced AAPC's 2021 chapter of the year, the Palo Alto, California local chapter, and highlight the ways in which they went above and beyond what's expected of them, putting them at the top of the list to earn the reward. We also have an article that Renee, one of our other editors, wrote based off of Laurie Buzeris's HealthCon 2022 presentation about mental health coding. In her session, she managed to take much of the complexity out of the behavioral health coding for medical coders by providing them with information and resources necessary to code correctly and in compliance with applicable regulations. So that article provides a great overview of her session, walking everybody through the regulations, documentation requirements, and other coding considerations. Also in the issue, we introduced a new column called Ask the Lab, which over the next few months will cover highlights from the Q&As by AAPC's Legal Advisory Board during their 2022 HealthCon 22 Legal Trends Panel. The first article in this series is going to share some expert advice doled out on the application of Medicare's anti-markup rules. Next, the June issue is also going to spotlight Family Health and Fitness Day, which is actually today, June 11th. It's held on the second Saturday in June each year, and it promotes physical activity, a healthy lifestyle, and the importance of parks and recreations and communities healthy and active. So you need to go ahead and check it out to learn about some activity recommendations and the added benefits of outdoor activities, as well as some suggestions of fun things to do outside. The issue also provides guidance on requirements for reporting principal care management. You'll want to check out the article by Caitlin Brack, in which she provides tips as well as insights into PCM codes and guidelines surrounding their use. And then AAPC's publishing department recaps HealthCon 2022, AAPC's 30th annual national conference. And we also put together a piece showcasing our top 10 favorite pet pictures from the chat wall. And then other great articles you won't want to miss include one on how to manage career curveballs, as well as one on the 7 clinical documentation pitfalls to watch out for. And then to round things out, we've got other coding, auditing and compliance, and practice management articles for you to enjoy and learn from. Now we're currently working on the July issue right now, so you can look forward to reading about cataract coding, the power of positivity, physician queries, and ICD sequencing, as among other interesting topics. So you won't want to miss that either.
Hey, Stacy.
Yes.
So I was in a meeting yesterday, and I gathered that July issue has a theme of ophthalmology or eye care. Is that right?
That is correct, yes.
And I believe, Rhonda, isn't that your kind of your jam? That's your eye specialist with coding and things?
It is my day job in ophthalmology, yeah.
And are you involved with this issue at all? Do you have an article coming up by chance?
I have an article coming up. I'm not sure when it's running.
Okay.
It's on a compliance take for ophthalmology.
All right. All right. Just curious. Hey, and real quick, you mentioned the pets. APC members are pet people. Yes. Now, Stacy, do you have a pet?
I do, actually. Let me
Go get it.
Marley.
So cute.
This is my little worker.
Yes. Love it. So cute.
Yes, he was very attentive during the conference and actually snoozed next to my coding book, which made for an absolutely adorable picture.
Adorable.
Oh, I love it.
What a face.
All right. Well, thanks for sharing that, Stacy. And golly, you guys have a lot going on. I know for this May issue that's currently out, there was an article about getting CEUs, which is like probably the most asked question in the Facebook group. And we've turned that into an infographic. We'll be sharing that in on our social media channels in the coming weeks. So look out for that. And we're just looking for ways to share the Healthcare Business Monthly content in unique ways. So look out for these different things that we're doing.
Awesome.
Stacy, anything else on your end?
No, I was just going to pass things over to Lee because as we've mentioned before, we wouldn't even have a magazine without member contributions. So I'm going to pass things over to Lee so she can talk about sharing your knowledge with your peers by writing for Healthcare Business Monthly.
All right. Thanks, Stacy. Yep. So just a quick plug for writing for the magazine. Like Stacy said, it's a member magazine and we rely on contributions. So if you haven't written for us before or you haven't in a long time, we're always looking for members to contribute articles in their areas of expertise. Just a couple things to remember. You don't have to be a professional writer to write for us. So if you're nervous about that, we're looking for your knowledge base. Our editorial staff can always help you polish the article if needed. So what we're looking for is your expertise. It's a good way to earn CEUs and get your name out there. And so if you think you want to write for us, just go to the magazine section on the AAPC website and it'll tell you how to upload your article. You can do it right through the website. And if you have any questions or concerns or you want to run a topic by any of us, you can always reach out to me or Stacy or Renee Dustman, who's the editorial manager of the magazine. Our addresses are email addresses are at the beginning of the magazine, and you can always reach out to us. We'll be happy to talk you through anything or help you out. And finally, just a reminder, we do work 2 months ahead. As Stacy said, we're working on the July magazine right now in May. So just keep that in mind if you're thinking about writing anything that's particularly timely. And I think that's it for me, Alex.
All right. Well, Lee, the link to becoming an author is in the chat. Our friend Lori Jaramillo from Boulder, Colorado says, I am going to write about my first time being a president or chapter president.
Oh, nice.
So
Excellent.
there you go.
Very
Looking forward to
nice.
hearing. Yeah.
And I can testify that they will do magic on whatever you write, because when someone asks me to write something, that's when I get the sweaty palms. I'm not a writer. As anyone knows, I could talk all day. I can chitter chat, no problem. But write even a memo that freaks me out. But these people are amazing. So I can put something together and somehow or another, they understand what I want to say and they make it look really good. So seriously, do not be nervous if you don't think you're a writer. It really is about the subject matter. And I'd like to throw out one quick idea for helping share the information. Use it at your local chapter. Do a quiz at every one of your meetings to see if people have read the articles and give away prizes, little prizes, if they know the answer to the question. Pull from all the articles and they'll be reading them and coming in and ready for your quiz. We've done that before. It's a lot of fun.
Nice.
Awesome. We love it. Thanks, Jackie.
Mhm.
All right. Well, Stacy, Lee, thanks for being with us.
All right.
And thanks for bringing Marley.
Oh, my pleasure. He loves to be a part of all the meetings. It was good to see everybody. Thanks, Alex.
Thank
We'll
you.
see you.
Bye, all.
Well, you guys, I mentioned we have someone, Kim Thrasher, who is studying for her exam. She says she has not scheduled her exam yet. She mentioned that she's just starting chapter 5, you're gonna have to help me with this, integumentary system.
Integumentary.
Oh, you made that so easy.
In.
Yes. That's where she's at in her study guide. So if we could give Kim Thrasher one tip, maybe something that that is a common misstep for those who are taking the exam.
Yep.
What can we do to help her be successful? Just one thing. I'm going to ask each of you. Jackie, will you start?
My suggestion to individuals learning is stay off the blogs, stay off your social media to get your answers. These people are not your study buddies necessarily. Use your books, read the guidelines, stay in your books. The exams are about the books. Read your books over and over and over. Know your books, know your guidelines. Don't worry about the plethora of blogs and things that you believe are helping you get there. My 2 cents worth.
Okay. Rhonda, what tip would you give her?
Budget your time wisely. And so you want to make sure that you set aside time, whether it's blocking off your calendar from work or from life, and making sure you get dedicated study time that's in there. Look for your answers from reputable sources, and know your learning style, so you know the best way to hit it.
Awesome. Christopher, I don't know your background. So have you taken the CPC?
Yeah, so I took it back in 2014, and the first time I took it, I got a 68%, which just, you gotta get 70% to pass, so it gutted me a little bit. But the thing that helped me the most was practice questions, practice exams, time yourself, and try to get good at that time management. The first time I took it, I ran out of time and I just had to fill stuff in. The second time I took it, I finished 45 minutes early, passed, and it was because I practiced that time management. I skipped the long questions and did the shorter questions first, and then went back to the long questions at the end. Just stuff like that. Practice. Time yourself, and that's what helped me a lot.
Awesome. And I have not taken the CPC exam, but I view and read comments from, I want to say hundreds, but it may be thousands of people who have taken or are preparing for the exam in our social media channels, our Facebook groups. And the one common thread I see, it echoes what Christopher said, is practice exams. And I just encourage you to take the practice exams, time yourself with that, because we know we have an idea of how many minutes you get per question, all of those things. So put yourself under the gun before you hop into the real exam, so you're used to that feeling. So that's my thought. But awesome, it's so great to have not only seasoned pros join us today, but we have students and those just beginning their journey. So then this is a great place for you to ask questions. So feel free to leave comments if you have them. So we are here today with the Education Committee, part of it, most of it, to discuss what is our process for finding speakers for our conferences. We have so many events these days. We have RiskCon coming up. We recently had DocuCon, I believe.
Mm-hmm.
And as Jackie mentioned early on, that we are super excited to reunite in person at our Denver Regional Conference, our HealthCon Denver, in August. And so just to kick this off, I'm going to start with you, Rhonda. Tell us about the committee that determines the education that will be presented. How do we decide what topics will be presented and those steps going forward?
Yeah, so absolutely. But before I do that, Alex, I do want to put a plug in for Denver. And let's get that online petition started so that all the classes can be in the lazy river. Because, right, I think that'll be a lot of fun. But outside of that, Right. The education committee, I like to think that we have a lot of fun when we do this, but it's actually, it's a lot of work goes into finding the right speakers and to making sure that we give everybody the best education experience that they can have. So we always have our regulars that contribute and contribute timely and all of that. But I guess some things that people, if you're looking to speak, and things that we're looking for, especially for a national conference, is apply for a regional first if you've never spoken at a national conference. Get the experience and then submit for the national. But the best thing that you can do is pick a topic that's true for you. Don't try to imitate somebody else and think, okay, well, they speak on this, so I'm going to speak on that. So you want to pick something that's true to you, because that's what you're an expert in, and that's what you can provide guidance in. So many times we get either the same topic or a very generalized topic. I'll use leadership as an example. We probably, Jaci, have gotten 100 applications for people that want to speak on leadership. Like, so what piece of that? Leadership is such a broad topic. What piece are you the expert in? And because we can't be experts in everything, right? And so pick something that's true to you and what you really think that you provide value, right? That you can pour back into others. That's important for us when we're looking through all of those types of things. When we have new speakers, typically we'll ask for just a quick video clip to see their presenting style and to help us to be able to make those decisions. My tip to you guys there, right? Keep it simple. Keep it out of your bathroom or your bedroom, right? Try to keep the background neutral. Keep it to the content that you're going to be presenting on, and present it just like you were going to be presenting it. And like you were right there, and just right, keep straight to that content. That's kind of the things that I can think of right now.
Yeah, as you mentioned, going in with, I guess a fresh perspective, I think about Sarah Reagan's presentation from Charleston. I don't know if you were there, but to see that, but she spoke about truckers. Her husband's a trucker, and the health related issues to that. And it was so engaging, and she tied that industry in with what we do so well.
Yeah, amazing example. Exactly.
Jaci, do you have any thoughts?
Yeah, so as a committee, we typically start with a blank slate, but we have tracks of categories of topics. So we always we understand that AAPC is in the business of healthcare, and we are trying to serve the needs of a lot of different people. Like Rhonda talked about leadership. We usually have a track for compliance, auditing, general coding, specialty coding, and on our larger conferences, inpatient facility, outpatient facility. So we really are trying to grab a lot of different topics. And like Rhonda was saying, sometimes we'll get multiples of the same idea. So for a speaker, narrow it down, take something, because you only have 75 minutes. So it's 60 minutes talk, 15 minutes questions. Narrow that down to something you really, really want. And then when we look them over, like Rhonda was saying, start with your local chapters even, speak there just to get that comfort so you can get a score so you can let someone know. And then I'm going to be honest, proofread what you send in. And have someone else proofread what you send in. I'm not my best proofreader of my own work, but I can proofread someone else's. So typically I have someone else look at mine. It doesn't do you any justice to send in a request with misspelled words and grammar that doesn't make sense, because it's not going to get the same attention. And I think it's fair to let people know that. It really is a profession. We, like Rhonda said, and as Christopher knows, we do have fun doing this because it's a really good end result. However, it is a very serious task, and we don't know everyone. It's like a resume. I don't know who you are, so all I have is this piece of paper. Same as with documentation from the provider. I don't know what happened, but I have this piece of paper. So be very careful about your wording, careful about how you present yourself. so that we get a better idea. And again, we have a limited spaces. So, you know, if you don't get selected on that first one, just keep going. And certainly if you have questions about the process, throw them in the chat now, and that's what I have for right now.
Now, Christopher, are you new to the education committee? How long have you been on that committee?
I am. This was my first go around, was for the Denver conference.
All right. And so tell me, what has this experience been like so far for you?
You know, it's been fascinating because so I first presented at HealthCon back in 2017, and it was amazing. I loved being a speaker. And so when this opportunity came up, I was really excited to be a part of it. And one of the things that I noticed that kind of surprised me this first go around was, as we were talking to people, you know, I knew a couple people, but Rhonda and Jaci and those who have been on here for a while, they knew a lot of people's names. They knew them as people, not just names on a list. Some who were newer, you know, like Jaci said, it was just going off of a resume. But there were a lot where they knew who they were. And it was really great to see that networking capability and that wonderful outcome of networking, of being able to see that Jaci and Rhonda and these others who have been on here for a while knew these people, recognized them, either knew how well they could do as a speaker because they've spoken in the past, or just knew them as a person because they've chatted with them at conferences and things like that. And so I thought that was just a really cool thing to see behind the curtains on that.
Christopher, through the process for Denver, are there any presentations that jumped out to you that you thought, oh, this is an interesting spin on an old topic, or a fresh take on something?
Oh, man.
I'm putting you on the spot.
Yeah, putting me on the spot now. Can I pull up the list real quick? So there was one that I was really excited about because I feel like we've gotten this a little bit, but maybe not for a few years. There were several applications about wound coding, which I think has become very popular and a lot of questions about. And so there were several aspects about it. And there was a particular one that we all really liked. And it fell, so I was over the specialty coding presentations, and so it fell into mine. And so I was really excited about it. I work in wound as well. So that one kind of jumped out because I'm excited to hear what that person is going to present on. And that's the other thing I noticed about this is the members of the education committee would get excited about presentations as well and say, I think that will be wonderful to hear, not just for the other attendees, but for themselves as well.
I love that. Absolutely. Yes. And you're onto something when the group is excited and eager to hear about that.
I think that's
Jaci,
one of the things I love the most. Sorry, Alex. That's one of the things I love most about the committee, is when we all get really excited about something, or the fact that we're all willing to respectfully disagree and debate those things out, right? So that we get the best education. It's not just a group of people saying yes, just to go along. It's we're right. We'll debate down to the last thing.
It is, and that's important because we know each other. And Christopher's new to the group, but we know him, so we're very comfortable with our exchanges. And I'll be honest, it's really difficult because sometimes you'll get 3 people who have submitted a very similar topic, and you're going through each line of it, trying to decide which of these 3 would serve all the attendees the most. Like right now, we're getting a lot of submissions on risk adjustment and different ways to look at risk adjustment. And it's a very popular topic, but we don't want to have 3 that are all the same, and we're trying to nuance. But I will say something that we also keep in mind is, would this be good for the next conference if we didn't make it on this one? Or would this make a really good article for the monthly magazine? And maybe this would be a
webinar.
Maybe this isn't great for a conference, but maybe it'd make a great article. So we are really trying to use the information in everybody's submissions the best possible way.
Jaci, Christopher, you mentioned that he kind of was helping with a specific topic or topics for the conference. So you each are assigned to different areas, is that right?
Yes.
Okay, and Jackie, in your area, what is that, and what has caught your attention from those submissions?
So I typically handle audit. Sometimes I share audit with compliance with Rhonda. It depends on if it's a regional or a health big event. And I usually take, if we break out evaluation and management separate, I usually take that track as well. And it's, to me, it's not, I'm not going to name one particular one. What I like is that I really appreciate that people are stepping out of the box of this is how you level a service. They are looking at different ways of auditing, get yourself prepared for an audit for any type of service. And within evaluation and management, they're looking at comparisons of different types of coding scenarios. People are really stepping out of the box, and it's very exciting because it's like, wow, because it hurts my head to think that hard. So when I see it, it's very, very exciting to see a different approach. And I think that's what I'm most excited about. In particular for Denver, we had some really interesting submissions within those two tracks, just looking at the legal side of audit and within evaluation and management, doing some comparison on providers who've done really well with these new guidelines and one not so much. We're going to look at the 99215 or go back and do some things we've done before. I think it's exciting, different approach.
Yes, yes. So you have all of these different takes on a common topic. How do you determine that this is what our attendees will want to see? This is what members want. Are you looking at feedback from surveys, or is it just you've got your ear on the ground for the industry to know what's happening and know what will be needed by our members?
Yes, all of that.
Okay.
But, and I should say, and I would love to hear from Christopher and Rhonda, but I'll also say we do look at prior scores. So individuals who have spoken for us before, we do go back and look at scores because even on ourselves, we do look at our own scores as well to see if it's a topic we should repeat or not. So we're all on the same playing field. Just because we're on the committee doesn't mean we're going to speak. We don't always submit something that wants to be heard.
I think that's a really good example, Jackie, because for Denver, typically, if I submit, I'll submit late, seeing what other applications we have in or fill in where we need a gap. And for Denver, I'm not speaking in Denver, and that's probably the first time I haven't spoken at one of our conferences in a long time. And I'm really actually excited about it, not for speaking and more lazy river time. That's not it. But it's really because I was so excited about the schedule. Like, we came up with such a great schedule that there was no need for me to have to fill in anywhere. And I think that's an amazing thing because we had so many good applications for Denver.
Rhonda, sorry, Christopher.
I was just going to say, one of the things that also I noticed was, so I gave a presentation at this last HealthCon about shared services and all the new guidelines with that, but there were so many questions about residents and students during that presentation, which doesn't have anything to do with shared services, but they get confused quite a bit. And so there were so many questions about that I almost thought, okay, I feel like we don't need to hear about shared services again. This is what the people are asking for. And so I was able to take that information back to the committee and say, hey, let's find a presentation about this. And nobody submitted one. So I'm speaking on that this time, and I'm really excited about it because I know it's a topic that people are excited for. And so I like talking to the participants and the attendees of the conferences and getting an idea of what would you like to hear at that conference. I think that's a great way to identify this as well. And I love the catchy titles of presentations. You get some where it's like gastroenterology coding, or I think we selected one for this coming conference called "Ain't Nothing But a Gastro Thing." Like, that's such a better title. Of course, I want to attend to that presentation.
Sure. It's fun.
Hey, Rhonda, what track do you help manage?
Oh, so I actually help manage the practice management and the revenue cycle. So those are the two topics that I typically run to the billing revenue cycle. Every now and then I help out with the compliance. Mary Ann Durling actually does the compliance in some of the outpatient facility. So which is great.
Okay. Lori is asking, when will the list of speakers be available for Denver? I'm trying to get that information. I don't know, do any of you know when that information will hit our website? No, I would imagine it'll be soon, but I just sent out a message to someone. And if I get that information before this broadcast ends, I will share that. All right. Well, there's so many different topics and we cover so much ground at our conferences. And I know we occasionally have students attend. What is in HealthCon Denver for a student or someone who's just kind of emerging into this career path? Do we have a track for students or no?
So
We don't have a track for just students because I think the demographics show that, right, that's not typically our audience.
Yes.
When we look at the surveys and that type of thing. But then I'm always going to say that a student can benefit from any of that education.
right. I think one thing that I know that, and I've been attending conferences for a lot of years. And one thing that we've all talked about before, when you attend conference, get out of your comfort zone. Because typically we go to the same presentations because either we want confirmation we're doing it right, or it's just nice and easy. I can sit there in the back of the room and order clothes as well. But we don't want that. You are coming to this to get education, step out of your comfort zone and start picking. This would be good for students too. Pick something that you know nothing about, learn something and walk away with something new. I think that's something that's so important to do. And who knows, it may end up that's something you're working in one day, but pick something you're like, wow, that's just, I've never heard of such a thing before, and step into it and learn something. And when we are selecting speakers and topics, we are thinking of the whole crowd, not just the people who do that one thing all day long, like with wound care, like Christopher saying, people who do wound care would love to hear that. But what a great idea for people to learn. We're thinking about how is someone going to learn this from this presentation. We're looking at how would someone show up, see these slides, listen to this, but what are they going to learn something? Are they going to walk away with a knowledge?
Yes, yes. And I can speak for myself. I moderate sessions occasionally, and I do not have this medical coding background, but boy, I mean, these presentations are very interesting and engaging, and you get something out of it. And I imagine that someone who's a student who does have familiarity with it, even on a small level, would get a lot out of the sessions. But with that, I think about if you're a student, we know that we have a few students watching this broadcast today. You should be attending your local chapter meetings now. You may not get or understand the presentations and the content completely, but this is your way to network, build relationships, and get a taste of what's to come as you step your foot into the industry. And HealthCom is an amazing way to do that. And we do, as I mentioned, occasionally have students attend. And what a great way to network. And that's just a way to start building those relationships that could lead to your first job. All right, well, let's see here. Now, Rhonda, was there any session in your track that really caught your attention that you're excited about?
There were several, I think that caught my attention and always continue to catch my attention on those types of things. Any of them that deal with numbers. So Rita and who she's presenting with is slipping my mind, in the past has done a really great practice management session that drives down to the data, which I think is really important when we're talking about those types of things, because the data is so extremely important. We have a couple on culture, which I think is great from that side of it. Those tracks, I feel like, because we work on kind of filling our own tracks and working on those pieces of it, pitching in with everybody. But I feel like my track got filled up like that first before we were even off the first phone call.
Yours did. It
Yeah,
filled up right away. It was just right when we got off the call and you're
Well
like,
done.
done.
I was like, woohoo!
You were mine was like stagnant for
Yeah.
Now, what happens with these individuals that maybe didn't make the cut? How do we, and we talked about that their submission is kind of a resume. Maybe we don't know them very well, or how do we create an opportunity for them to present in the future?
So if you don't mind, like, I'll just give a quick take on it, because for those, if you submitted anyone and at any of them in the past, like, don't take it personal and give up and not try again. Like, keep trying. I speak for a lot of different organizations, but guess what? Even I don't get picked all the time. So, you want to make sure that you just keep trying, and then feel free to reach out and ask, what could I have done differently? How could I improve? What's one thing that I could have done that would have helped you pick me? Right. And try to learn from that and then refine that skill for the next time.
Yes. Yes. Jackie, any thoughts?
No. I think I just want to go back to something Rhonda was talking about. If you're new and you get selected and you need to submit a short video, I really want to stress what she said. Make it like it's that day. Get your slides together, proofread them, be ready, be in a good space. I mean, mine's cluttered. I wouldn't use this background. I know I'm cluttered back here. I would try to make it a little bit more professional. I would dress professional and make it like it's the real thing, because this is how we would know. So I really want to stress that part of it. And sometimes you might get an email back saying, that was really good. Could you just kind of tweak this one thing and we'll work with you, or it could be, this topic is great. I think they've got potential. And one of us will work with that person to get it to where they can deliver it comfortably, because we know they've got that subject matter expertise. We know they've got it and just need to work out a few things to deliver.
Yes. Christopher, any thoughts on your end?
Yeah, I love the idea of treating it like it's a job application. I just think that's such great advice, especially, I know a really good technique for self-improvement when you're applying for a job is, if you don't get a job, reaching out and asking, okay, what could I do better? What could I improve on? What were you looking for that you didn't see? So it's an opportunity to grow, improve, and become better. And I think what a great opportunity that is here as well, or reaching back out and saying, okay, can you elaborate a little bit for me and help me understand what I can do better next time? Because we want to hear from you. I mean, there were so many applications submitted and so many great topics. And so we want the best presenters. We want to hear the best, and we want to help you get to be the best. So absolutely do that. Talk to us at these conferences that you're attending. Meet us, tell us you're interested, ask us for advice there as well. Present at your local conferences, get good scores from there. Like Jackie said, all that stuff will help just kind of build your speaking resume.
Yes, and I love that thought of speaking at your local chapter. So right away, you've got an opportunity to build those skills there. But we also have, we have over 500 chapters and an amazing circuit. We spoke about Jackie, Rhonda, and Christopher. I'm sure you've spoken at chapter meetings, and just being out there, it happens virtually now. There are all kinds of opportunities to speak. And you even see that in our Facebook group, chapter officers saying, hey, I need a speaker on this topic. So it probably wouldn't hurt to even reach out to local chapter officers and say, hey, I would love to present about this topic. Just to let you know, I'm out there available, and build those skills through that. And
Yeah.
that's how we get to know you, and the chapter officers get to know you, and you can build towards that HealthCon experience.
That has been one of the cool experiences about the last couple of years, is being able to broaden your sphere, your orbit of influence. I was able to speak to local conferences in Alabama and Wisconsin and New York and a couple others where I would not have been able to do that if we hadn't all transitioned over like this. So wonderful opportunities to do that kind of stuff now.
Yes, yes. Awesome. Well, I am so excited about Denver. And Rhonda keeps bringing up this lazy river. And so, Rhonda, is there like a water park or something at the hotel?
There is. There's these. It's by far my favorite Marriott to go to. Outside they have amazing pools, and then a lazy river that goes all around it. There's putt golfing and all sorts of outdoor stuff, and we're going at the perfect time to enjoy all of it. So I was lucky enough to attend a conference there in the past where that lazy river was just a lot of fun.
So what are some of the things you're looking forward to in Denver? I look forward to going to, hopefully there's a Rockies game, baseball game. I love going to MLB games. Anything that you're excited to be in Denver for, to check out?
Food. I always love going to the local places and trying what people seem to love there. So I love that stuff. Love the food.
Yes, awesome. And I guess I'll have to bring my swimming suit to get in that lazy river and watch some conference virtually. Well, I got my laptop on my lap on my donut.
I'm going to throw out one more thing. Just since we have all these people joining us today, remember, part of conferences, like I think Christopher was talking about before, is making sure that we're giving back what you want. So when these surveys come out after conference or anytime, fill them out so we'll know what you want to hear. Because if you don't tell us, we're going to go with what we believe strongly you want in a conference. But anytime you can give us suggestions and we can get that information back, it does help the team kind of guide some of these speakers and topics in a direction that people want. If we're not given enough of something and you feel it's important that we add some things, then get it out there and we'll do our best.
Yes, awesome. Well, our friend, I mentioned her earlier, Lori Jaramillo, who is in that area. She said that she posted something about visiting Denver in the Facebook group, and I just looked, and she's got a picture of the water park in there, which looks crazy. But she says there's red rocks, and I'm sure much more to see.
I believe her post, Alex, is where I started the petition for the classes.
It is. It's a gorgeous area. I'm really
Beautiful.
lucky. I'm going to spend about a week in that area at the end of June. And Colorado is just an incredible state anyway. I've never been to this Gaylord location, so I'm really looking forward to it. It's going to be beautiful, and the weather, I'm sure, is going to be perfect time of year for that.
Yes.
Yeah.
All right. Hey, I'm going to switch gears just a little bit because I know Jaci and Rhonda so well. We've spent time together many conferences now. I don't know Christopher too well. Christopher, I'm just going to put you on the hot seat and we're going to dig into your life. And Rhonda, Jaci,
I think it's
if
good.
if there's anything we need to know about Christopher as we have this quick discussion, don't hesitate.
Here we go.
So, Christopher, what is your role at Intermountain?
Yeah, so I'm a technical manager of coding and reimbursement. So I'm over various specialties. I'm over all advanced practice providers, residents and students. I'm over general surgery and gastroenterology, wound and podiatry, and infectious disease. So yeah, lots of area to cover on that.
What is your background in the business of healthcare, and what led you to AAPC?
Yeah, so I got my undergrad degree in accounting, and I thought for a brief minute that I would be an accountant. And about halfway through that degree, I realized that's a terrible idea for me. And I did not want to become an accountant, but I knew that it would be good information for me to have and a good degree to have. So I stuck with it. And I started just kind of trying to figure out what I wanted to do. And I ended up getting an unofficial internship with the hospital administrator at the hospital in the town where I got my undergrad degree. And I fell in love with healthcare. I thought it was such a fascinating and complicated field with so much opportunity. And so I went on and got my master's of healthcare administration degree. And while doing that, I found just this job as a junior coding consultant for Intermountain Healthcare. And I thought, maybe this is my way to break into healthcare. And so I got that job. In my interview, I told them I have no idea what coding is, because I didn't at the time. But they were looking for someone who was a good presenter, because I would be mostly presenting to physicians on how they were doing on their coding. And so I got the job, loved the company, loved the team, and I just stayed and started, getting more responsibility, and I love it. It's a fantastic field. Coding is fascinating, and it's not very often that I run into someone who actually knows what I do for a living. But occasionally when someone knows about medical coding and medical billing, it's wonderful to have those conversations with them.
That's awesome. That's so good to hear. What certifications do you have, Christopher?
So I'm actually, sorry, vacations you said?
No, sir, certifications. Like
Certifications.
Thought it was
Vacations.
vacation.
That is
yeah, what
complete
vacations?
right
do you
turn.
have?
I'm like, okay, let's pause.
No.
So I'm a CPC certified, and I'm certified in general surgery coding as well.
Okay, awesome. Well, it's so good to get to know you, and I'm sure we'll see your face around more at conferences and on social hours and then different avenues. Will you be writing in Healthcare Business Monthly, or have you in the past even?
I have not written in Healthcare Business Monthly. A couple of my coworkers have. I've given a couple webinars for AAPC. I'm giving another one next month about the new shared services guidelines for 2022 and what to expect in 2023. So if you're interested in that, there's a little plug for you. I love presenting, so that kind of stuff is just so much fun to me. I know it terrifies some people, but for me, I love it. So yeah.
Yes, awesome. Well, Rhonda, Jackie, anything that you'd like to ask Christopher while we got him on the hot seat? Or you know it all?
No, not even going to pretend to know it all.
No.
I'm just super appreciative of the fact that he didn't call us out by our age, just our experience.
I wasn't gonna say that.
We've been appreciative of having Christopher new
Yeah.
on our committee, because he brings a whole bunch of fresh ideas. And it's always nice when we have new committee members, because he questions, and it makes us rethink things, and it keeps everything fresh. So we're loving it. We're super glad to have him as part of the committee.
New energy is always good. Excellent.
Yes, awesome. Well, I'm just looking through the comments right now. We've had so many great encouraging comments, members helping each other and just sharing thoughts and ideas.
It's a beautiful thing.
I
Yeah.
love it.
We do have a comment. I just want to address this one. It's a long one, and it's tough to while we're live to get deep into it. But this is from Sip. Let me just say Sip Hekio, and it must be an international member. I apologize for not saying your name very well, but just talking about jobs and trying to get the pay that you are hoping for. And when I see posts like that, I always encourage our members to just build relationships and know the coding professionals in your area and find out what opportunities are available in your area, and let them know what you're hoping to achieve. Because I know, I don't think you disagree, you guys, just that submitting applications and hoping that they catch your vision it's tough. It's tough. So when you know someone and say, hey, these are my skill sets and this is what I have to offer, and this is kind of like the pay range I'm looking for, that that helps personalize the situation and can help you get a little closer to what you're hoping to achieve.
My local chapter got me, before I opened my consulting business, my local chapter, that's where I had all the jobs I had through my local chapter. And then with that local chapter and other organizations that I was a member with and going to those meetings, that's where I got my clients for my company. And I wasn't selling. It was just knowing them. I'm not a seller, did retail for years. It's just talking to people. It's just chitter chat, talking and hearing what's going on and being friendly and comfortable. And the local chapter, I tell you, I cannot stress that enough. They're just a wonderful source of networking information. And like Christopher is saying, now with the virtual, you can get to know people everywhere. And with so many jobs being remote, I mean, it's out there. It's not, I'm not saying it's easy. Don't get me wrong. But I am saying there is opportunity by networking in a lot of different ways.
Yeah, and so our author of that comment says, so essentially education doesn't get you in, it's who you know. Well, you have to have the education. Now I would,
Right.
yeah, I would say it's 50%. Yeah, it's a part relationships and part education. And I would bet people want to work with someone who is willing to learn, who may not be like the most perfect coder on the planet, but someone who can look and say, I'm fallible, but I'm willing to learn and I'm easy to work with and get along with, and I want to be my best.
Yes.
Yeah, so Alex, I'm going to say, right, you like, and just exactly what you said, what you know is extremely important, but your interpersonal skills are just as important as any book smarts or any knowledge that you have on that type of thing. And yeah, every day you have to sell yourself, every single day. And so a local chapter is the perfect way to do that, perfect way to network and to give you the opportunity to sell yourself to those future employers.
Yes. All right, we are going to wrap it up with that. We had such a great talk. Christopher, so good to meet you. I look forward to meeting you in person. Rhonda, Jaci, yeah, Rhonda, Jaci, so good to see you again. And I'm sure we'll be doing this for some other project down the road. But I'll see all of you in Denver. All of our members who are with us, thank you for joining us. Our panel, just stick with me just for a moment. If you you're watching this live, but you can also listen to this on our podcast. So if you pull up the AAPC podcast in your podcast app, you can listen to this discussion as you are doing chores, mowing the lawn, gardening, whatever you're doing, whatever you like to do. But it's just a great way to stay connected with the community. So we will see you all in 2 weeks. Thank you, everybody.